Well, good morning and thank you. And I tried to get my 4-year-old son to come up with me, but I guess he didn't want to do it. You know, one of the things that I'm so excited about PACE, it's not a competitive model of care. It's a collaborative model of care. And I want to tell you that the 3 years that we took, it might seem like a long time, but as a result of the 3 years, we have such an integrated and collaborative team of healthcare professionals, both in the private sector and in the public sector. And I think it's important when you look at even the signage and everything, this is a partnership with the Commonwealth of Virginia. And we're all embarking on a new mission. When you have a grand opening, it's normally a new building's been built, a new business is opening, but this is really a change in how we look at caring for our elders. And I've been in nursing home care for 34 years. And when I first got in it, I thought, well, we're doing great things. I mean, we're helping the elderly. What would they do if it wasn't, for nursing homes? But I think as you start to get older and you start watching your parents age and you start traveling around the world and you start traveling around the country, you see that there's different models. There's better models. And clearly, if you ask the elderly, they want to be cared for in the communities that they grew up in, they worked in, and that they lived in. They want to remain a part of that fabric. They want to go to the same churches. They want to be a part of the same, groups of people that socialize and get together. So what I'm so excited about is this program here. It literally will change the lives of thousands of people over the next 5 to 10 years. People that otherwise would have lived in fear that someday maybe I will require a nursing home. Or maybe my wife, who I've been married to for 50 years, will have to be in a nursing home. How will I get to see her? And the beauty of this program is we're all working together. Physicians, specialists, healthcare providers, and we're all trying to figure out how can we provide the best care to this individual, not just in the doctor's office, but in the home, in transportation, in how they communicate. So we're truly, truly excited about this. Everything Kissito does, we want it to be a model. We want it to be a best practice. We're fortunate there's only 90 PACE facilities in America, so our goal is to be the best out of 90. And as soon as this is the best, we really look forward to going to Salem, to Bedford, to Vinton, to Blacksburg, and being able to expand this program. Our goal is 800 people can avoid having to be institutionalized and be able to live at home in the Roanoke Valley. And that's going to employ about 500 new people that are going to be working in PACE. So we're very excited about the opportunity. We're very excited about our partners. I want to mention one partner in particular that has sort of worked through this with us day in, day out, thousands of emails. But, the Commonwealth Department of Medical Assistance Services, Terry Smith and all of her staff have just done everything they can to make this a successful program. So I really want to recognize and thank Terry Smith. Now, it's my great honor to introduce a dear friend of mine, my mentor, somebody that, like my board says, Tom, you got to slow down, you got to stop doing too much, but actually an advisor and mentor to our entire organization. Mr. Brand has had a remarkable life, and every time I'm honored to go with him somewhere, maybe to a reunion at VMI and hear the stories about pre-World War II VMI, learn about the Marshall Plan and his active involvement in that, learning about starting up TAP, and just hearing all the stories about getting on the phone, with President Johnson or Sergeant Shriver. And even one day I had a voicemail and I didn't get the message, and I listened, and Mr. Brand was saying, Tom, get over to my house right away. I've got President Carter's daughter here. I want you to meet her. and he's quick to get on the phone, too, to call the governor. And I just love his way of business operations. But Mr. Brand's programs, Kissito would be so happy if we could just accomplish a fraction of what he did, because most of the TAP programs, unbeknownst to everybody in Roanoke, have gone on to be statewide programs, and then they've gone on to be national programs. And the work we do internationally, I tell you, Mr. Brand is just as well known for his international work. I mean, things he did in the private sector, I mean, Bangladesh, China, Africa, I mean, just amazing, amazing things. And I know anytime I tell him about something, I told him the other day, I said, have you heard about purpose-built communities in Atlanta, you know, Cousins Properties? Tom Cousins was able to turn on, Tom Cousins, oh, he's a friend of mine at YPO. Let's go visit him, you know, and he's just been everywhere, and it's just been our pleasure and honor to have him be a part of our organization and a part of my family's life. So I'd like to introduce Mr. Brand, who will say a few words for us.
It really is a pleasure for me to be here for a number of reasons. It's amazing that this concept this is the first one in the Valley, and it's the first one in our region, and we need to work together to make it successful. In partnership with the state of Virginia. I remember when I was chairman of the State Board of Health many years ago, we visited nursing homes. And we've tried very hard to figure out ways to keep people out of nursing homes and let them stay in the community. And this is an example of how we're going to do that. And I like to think of this as the whole facility, the whole idea is sort of an extension of your home. People can live in their home and still have the services that they need and stay with their family. So I think that the PACE program should have a subscript on the title, and that is, it's a home extension program. You stay in your home and you can do what you need to do, God willing, and with your whatever you're able to do physically. And I'm particularly excited and interested in this organization. And as most of you may know, I spent most of my life dealing with low-income people and trying to help people from Head Start on up to be independent and make a living and be self-supporting. And when you get to be 55 and older, like I am, you really can't do everything you wish you could do, but this program is exactly what I have tried to do for most of my life, is to try to make people independent and self-supporting. And as I say, this is an extension of your home. I'm particularly pleased to be associated with Kissito because they're not in this business to make money. They're a nonprofit organization. As a matter of fact, they're taking what income that they have and doing what they can as a global citizen. They are trying to create a better life for people in Africa, at least 4 countries in Africa: Uganda, Ethiopia, Sudan, and Somalia. And they are not in that to make money. They're in that to create a better world. And that's what we're doing here, is we're trying to create a better world. And I've gone with Tom to Academy of Science meetings, and as he said, with presidential meetings, to work on issues together, not for profit, but to make it a better world. We spent 3 days at the Institute of Peace in Washington because we wanted to see what we could do to promote peace in the world and not have wars. That's the ultimate goal. So I'm pleased to be a part and associated with this organization that's trying to make this a better world. And we're doing it one person at a time, and this program is the start for the Roanoke Valley. So thank you very much for being here.